of State for Health, Dr. Ishaq Salako, has assured Nigerians of improved health welfareism through the launching of the presidential initiative on unlocking value chain on health sector to ensure availability of drugs and medical devices for the treatment of common diseases. Ayodeji Tomori-Oluwunmi, while x-raying the causes, symptoms and preventive measures against diabetes, reports that the Minister of State for Health, Dr. Ishaq Salako, also emphasized the importance of developing traditional medicine for a collaborative effort to tackle the menace of diabetes and its negative...
Diabetes is a chronic condition that occurs when the body cannot effectively use insulin, the hormone responsible for regulating blood sugar levels. If not properly managed, diabetes can lead to severe complications, including heart disease, kidney failure, and nerve damage.
There are many types of diabetes. In those with type 1 diabetes, that organ is no longer producing that hormone called insulin because the body's immune system sees that pancreas as if it's a foreign body. It attacks it, destroys it. But the more commoner type of diabetes, we call it type 2 diabetes. In these people, they still produce insulin, but that insulin is no longer effective. We may see diabetes in pregnant women too. We call this gestational diabetes. Develops during pregnancy, but once the woman delivers, within weeks, that blood sugar normalizes.
We usually say type 2 is hereditary, even though for type 1 also, it can also run in families. But when you talk about, hereditary pattern, you want to talk more of type 2.
Recent studies highlight the alarming rise in diabetes cases, affecting millions globally and posing significant health challenges.
There are three key things in managing diabetes. First is diet. We need to reduce the quantum of food that such a person eats generally or at a sitting. We prefer smaller quantities many times a day rather than three, large meals.
And then taking their medications regularly. Of course, as they come for regular clinic visits, the medications can be reviewed. And also exercise is very important. So diet, medications, exercise, these are three key things.
In response to this growing concern, Nigeria's Minister of State for Health, Dr. Ishaq Salako, stressed the importance of preventive measures and healthier lifestyle choices during a recent event.
I can tell you that the health sector renewal initiative of the present administration led by President Bola Ahmed Tinubu has fashioned out ways and strategies to tackle these challenges head on. First is to ensure that we tackle it at the preventive level. We are also going to ensure that those who have the disease, we are able to support the treatment. The President has launched a presidential initiative on unlocking the value chain in the health sector. And the whole essence of that is to ensure that drugs are made available to our people. Medical devices are made available so that we can treat common diseases and illnesses like diabetes. Again, we are also going to put a lot of emphasis on developing our own traditional medicine to the extent that doctors can have comfort, can be comfortable, can be confident in prescribing traditional medicine for some of his illness.
Dr. Salako reaffirmed the government's commitment to raising awareness, implementing prevention initiatives, and providing necessary support for those living with diabetes. He called on Nigerians to adopt healthier habits and collaborate in efforts to minimize the impact of the disease. Ayodeji Tomori-Oluwunmi, OGTV News.
With our special report.